so now it's this whole new paradigm that daily it's different. What I mean by that, growing up as a kid, yes, I went from on demand to prophy, and I knew what a bleed was. I knew how to treat it. Shifting the brain to go, you can't automatically treat right now while in trial. There was a whole relearning as if newly diagnosed.
That was blood brother Bobby Wiseman kicking off a patient roundtable discussion about gene therapy for hemophilia B patients. We have 3 blood brothers today from the community on this segment to share their thoughts about gene therapy. All 3 of our community members have hemophilia B. Rick Starks is a well-known community member. He's 70 years old, and while he stays informed on the latest research, he has chosen to stay on his current treatment. Colin Johnston is a mild hemophilia B patient, and it's really interesting, actually, to hear his thoughts about gene therapy and how the new doors are opening for him to actually consider the possibility. So we're super psyched that Colin is with us today. And Bobby Wiseman rounds out our roundtable. Most of you know Bobby is a legend in our community. He's a legend in our bleeding disorder camp community, and he has participated in a clinical trial for hemophilia B gene therapy for about the past 10 years. He has terrific insight to share about his experience, and this is going to be a great discussion. Again, this segment is brought to you by CSL Behring, a global biotherapeutics leader focused on serving the rare disease community by providing innovative therapies. They now have a first-of-its-class kind treatment for hemophilia B. To learn more about this treatment option, visit beyondhemb.com and download the B Support app from the App Store or Google Play to stay up to date on relevant information and to manage your treatment journey. Now let's get to our roundtable.
Gene therapy, the discussions I've had in the community are probably the older, more established patients aren't really leaning towards it. Like myself, I've been in bleed free now for 8 years, almost 8 years. And if it's not broke, why fix it? That's my philosophy and a lot of the older philosophy. My name is Rick Starks. I'm a 70-year-old in the community. I have severe hemophilia B, diagnosed at birth, been self-infusing now for 52 years, and still have good veins too. That's what's amazing.
So for me personally, at least, I'm mild. I think my levels are about 9 to 12%. They've been a little different over the years, and I mean, for a long time, I feel like you had to be severe or at least moderate to even get gene therapy. So I think it's pretty new that milds even can in the first place.
I was born in 71. When I came onto the scene, there was just that shift over from cryo to factor. Every other day, prophy. No, correction. Where at the time I was on demand. Then my doc gave us prophy and said, this is how we going to write the script because of the, issues I was having. Then went to prescribed prophylaxis off of plasma derived. Then went on to recombinant. Then went on to extended half-life. In the course of all that, participated in trials from the recombinant to extended half-life to see what would work best for me because I was an anomaly. Some things just didn't work regardless of the product. And coupled with that of having, because psoas bleeds were my target. So I could be out of commission 30 days just with one psoas bleed. So my outlook on managing my bleeding disorder was to be able to do what I wanted to do and needed to do.
Well, the more options you have, the better off you're going to be in any treatment of any disease process. I'm more inclined to do research now into a product before I change. I just don't hop on it because it's the latest trend.
I would just say that even severes, milds, anybody with a bleeding disorder, I really think can live the life that they want to with the right treatment plan, the right mindset, and just trying to think about doing things the smart way or the way that's going to be safe for them rather than the way that they want to or the easiest way.
And so I'd always learned how to just adapt and accommodate. Even before gene therapy, my bleeding disorder was not the center of my life after a certain age. So when the option came up, part of my decision was based off of conversations with my mom, docs, family, and my faith that got me through it. And also from some of my initial clinical teams. Okay. Did I read all them lovely pages they gave you? No. Did I understand the frequency of visits? No. Did I like being a pin cushion the first 3 months, 6 months? No. Did I like filling out the bleed diary? No. Did I like providing a semen sample the first 2 years? No. Did I like answering the same hemophilia quality of life standard question? No. Did I have the answers to questions? No, because I didn't know what questions to ask post gene therapy. Day 5, day 30. One of the questions came to pass to learn that what are my factor levels? Okay, I'm not treating, but then, I'm getting these labs, once a week, and the results are coming back, 1%, 5, 7, 10, 12, 35, on up to some 60. And I'm like, okay, I know I haven't treated. Okay, it's doing this thing. Then when it, a couple of times there, when it dipped down, 1 to 3 points, and I freaked out. And let me be clear, I'm like, what in the world's going on? Because I've been so used to and reprogrammed that it's going up and it stayed there, but now it's dipping 1 to 3 points. And called back to the treatment center, sent a my chart note, and the adult nurse sent me back this long email explaining different components to it because I was freaking out. Yeah, let me be clear, because I thought something was wrong because I'd heard some of the guys where it didn't work for them, but their didn't work was in that first month. But I'm like, I'm now 7 months in and the level's that high, and then see it start to dip. I'm like, something wrong. 1 to 3 points, something got to be wrong. I mean, I'm sorry, but that's where I was at. And then she explained that this is normal because, normal body fluctuations, temperature outside, if you had a sinus infection, all kind of stuff. And it made sense. So then when I had another set of labs, a month later, it was, like 1 point higher. Then labs, another couple of months, it was back to its normal. Because then I had a benchmark understanding. It was a new set of knowledge that I had to understand and not get freaked out with certain parts of it.
Honestly, it was just finding out that there's gene therapies now that milds can get now, because I mean it was just completely off the table for years, and especially like through trials and things like that, you definitely weren't getting it as a mild, um, and so like now it's a little bit possible, and so it's like maybe I should at least understand this better so that I can make an informed decision if I do or don't want to.
Your levels are now lower. You're not cured, which is probably one of the biggest myths, is that it cures hemophilia. You're not cured, but you're down to a mild level. You could still use prophylaxis, and if you're doing something that's going to be testing your boundaries, let's say, for that extra protection. But on a day-to-day basis, you're pretty well protected, I believe, with gene therapy.
Yeah, I think everybody can do whatever they want.
Where gene therapy, I feel, comes in is for those that are not compliant with their prophylaxis. If their lifestyle is busy or for some reason they have a hard time maintaining a prophylaxis schedule, gene therapy for them would be an excellent way to protect themselves from injury.
Yeah, 5. I'm in almost end of year 6 now. They are both questions and thoughts. There was a bunch of us who were able to get together a couple of weeks ago, all who've been on gene therapy, all who are successful on gene therapy. And part of the discussion was like, you can't get rid of some of the hemophilia stuff, be it the joint damage piece, the walk, or the what have you. But then the things of what do I do here and this, that I was so programmed to know how much factor to keep on hand, how much, how to fill out an infusion log, all the stuff. And now it's a whole something different. Like, on the work front, when it's choosing a new health insurance plan, I still have to disclose to HR the hemophilia piece because I'm not cured of it. And because I went through a clinical trial. So I still do bleed. I still do have a backup set of factor at home. That where my original 100% correction dose was anywhere 4 to 6,000 units. Now my correction dose is 1,250 units. I'm still 185 pounds. So you see what I'm saying? So it's this like, okay, right. It's all that to deal with. Will there be a clinical trial, a new clinical trial for previously dosed folks that we go into that or what? The answer then was, we don't know because nobody had the answer. And now there's new data coming out and different conversations of what could happen. In that whole realm of gene editing per se and some other things. It's real complicated sciencey.
There's so many things that are unknown at this point about it, but overall the feeling is it's being received fairly well.
You just have to have the right support system and people around you that are knowledgeable in that area to be able to make it accessible for you.
Loved this conversation with our hemophilia B blood brothers. So listen, regardless of where you are in your life, new science and new treatment options are here. So just like Colin said, rally that support system and do your research and make the decision that fits your life and what you want to accomplish. We will see you next month on our gene therapy segment where we'll recap our entire season. Once again, this segment has been brought to you by CSL Behring, which now has a first-of-its-kind hemophilia B treatment. Visit beyondhemb.com or download the B Support app wherever you get your apps for more information.